Hi everyone, Professor Shaffstall here from Bakersfield College, and I want to create a little um, basic coding review video set to help my students going from coding 1 to coding 2 refresh what they learned in that first semester. I hope everyone finds this useful. It's not just for my students, but the book that we are using is Pearson's Comprehensive Medical Coding: A Path to Success. It's very user friendly. It really translate the knowledge in a way anyone, if they sat down and practiced, should be able to understand. And I really enjoy that. So this week I want to talk about the concept of coding sets. So if I say the term coding set and you don't know what that is, you should probably watch this video. Even if you do know what this is, this will be a good refresher because this concept is something that's very important for a career in this industry. These are things, this is going to reiterate things that you should know. So I would recommend making flashcards with important dates, important terms, that kind of thing. But I want to go ahead and review this information and refresh this information and maybe clarify some of this information. So let's get started. Let's talk about code sets with a quick review. So we're going to start with the simple question, what is a code set? The short answer is a code set is a distinctive system of medical codes. So it's simply a system of medical codes to translate verbal and written narratives into codes to be transmitted. So why are there multiple code sets and why do we need to know them? Well, different organizations throughout the history of the United States have created different code sets. So as needs arise, code sets are created. So each code set was created for a distinct purpose. And that is why we need to understand what a code set is and how it's used to have a firm understanding of when to use code sets appropriately. How do we know what code sets to use and when to use them? Well, we know what code sets to use and when to use them because HIPAA mandates the use of specific codes set for specific purposes for all covered entities. HIPAA requires basically every healthcare facility in the United States to use the HIPAA mandated sets to communicate the information needed for billing and filing electronic claims. So some of the HIPAA mandated code sets are CPT, HCPCS, ICD-10-CM, ICD-10-PCS, CDT, and NDC. So with all these different code sets that have different purposes, we need to understand what those purposes are and how those code sets are used. So that's why code sets are important, not just for a medical coder, but for a health information technician and any and everyone in the health information management industry. So let's dive a little deeper and go into talking about some common code sets. So I named you some of the HIPAA mandated code sets, but I want to talk about some of the ones that you may be familiar with in this program at Bakersfield College. So we're going to go over three. The first being ICD-10-CM. ICD-10-CM is the International Classification of Diseases, 10th revision, clinical modification. Everyone should know what ICD-10-CM stands for. So when I say, what does ICD-10-CM stand for? You should say International Classification of Diseases, 10th revision, clinical modification. So we should know what it is when it's written out and when it's abbreviated. The second code set that we're going to go over is ICD-10 PCS, or the International Classification of Diseases 10th Revision Procedure Coding System. And the last one's going to be CPT, also known as Current Procedural Terminology. So let's look at each one and identify when we use these. So ICD-10-CM is used to diagnose or used to code diagnoses in all patient settings. So no matter where you're being treated, at your physician's office, in a laboratory, in urgent care, in the emergency department of a hospital, or even admitted as an inpatient to the hospital, your diagnosis code is going to be an ICD-10-CM code. Okay, so all diagnosis codes, ICD-10-CM. All patient settings, ICD-10-CM. ICD-10-PCS is used to code procedures, but it's only used to code procedures in the inpatient hospital setting only. This means a patient has to be formally admitted as an inpatient to the hospital in order for this code set to be used. Okay? So this is the only time we use ICD-10 PCS to code for procedures. Now we have CPT, which is also the code set for procedures. And this is in the hospital outpatient setting and physician offices. So basically all outpatient settings. So all ancillaries, everything but the inpatient hospital setting. So it's kind of confusing. We have two different code sets for coding procedures. And it's important, it's imperative to know that ICD-10 PCS is only used for admitted inpatients, and CPT is used for all other patient encounters. So this is going to be your ED. This is going to be at your physician's office. This is when you go get an x-ray. This is when CPT is used versus ICD-10 PCS. Also, CPT is also used for coding physician services. So it's for coding physician fees. So not only are they treating you, right? They have to identify why you're there, what's happening to you, but what did they do? And they need to be compensated for that. So CPT is used for outpatient procedures and for physician billing, and physician billing in all patient settings. So it can get a little confusing, but this is why we need to write things down, take notes, and review concepts so we understand what code sets are and when we use them, and what patient setting we use them in. Now let's dive into each of these common code sets. We're going to kick it off with ICD-10-CM, and we're going to talk some details about it. It's important to know the name of every code set that you're dealing with, and also who developed it, why, the format, the length of the codes, all that good stuff. So ICD-10-CM was developed by the NCHS, or the National Center for Health Statistics, based on the WHO's ICD-10, and the WHO being the World Health Organization. So if you notice, ICD-10 belongs to the WHO. ICD-10-CM belongs to NCHS and is used in the United States. So the code set ICD-10-CM is only used in the United States, but it's based on the ICD-10 code set developed by the WHO. So why do we need a different code set that's different from the rest of the world? Because in the US, we want to focus on morbidity, so disease and illness in the United States. We don't want to just measure the public health of the world. We want to measure the public health of the United States and what's happening to us immediately. And the code length for ICD-10-CM is 3 to 7 characters long. So some codes can be 3 characters, some can be 4, all the way up to 7. And the code format is alphanumeric with some examples below. So we have I-10, which is only 3 characters long, and we have A52.15 and T50.811D. This should not look foreign to anyone going into the Coding 2 course in the HIT program at Bakersfield College, but I want to remind you about the background and the importance of each code set. So ICD-10-CM is used to code diagnoses in all patient settings, and I want to make sure this is clear. All patient settings, whether it's inpatient or outpatient, use ICD-10-CM for diagnosis coding. ICD-10-CM is commonly referred to as diagnosis codes or CM codes or diagnosis coding. So in the work world, if someone says this needs a diagnosis code or a CM code, you know exactly what they're talking about. And that's often how they will be mentioned. So diagnosis. Codes describe a lot of things. So when we think diagnosis, we usually think illness or disease, but this is also conditions and injuries and other reasons for seeking healthcare, like vaccinations, preventative healthcare. This is all under the diagnosis coding umbrella. So I like to think of medical coding as translating the story of the patient into alphanumeric codes. So we're telling the story of why the patient's seeking treatment, what happened to the patient while they're here, and we need to tell that story in as much detail as possible. So I like to say that ICD-10-CM codes explain the why in the patient's story as to why this patient is seeking healthcare. So the patient is seeking healthcare because they're having chest pain, or because they have an ingrown toenail, or asthma, diabetes, or they need a vaccination. So we're explaining the story when we code as to why the patient's seeking healthcare, and that why is completed by utilizing ICD-10-CM codes. Some important notes to remember about ICD-10-CM. Sorry about that, let's go back. Important notes to remember about ICD-10-CM was that it was implemented October 1st, 2015. So it's a relatively new code set. You need to know that it replaced ICD-9-CM volumes 1 and 2. Okay? ICD-9 was 3 volumes, and basically it ran out of space to continue to add new codes, and it couldn't get down to the granularity, the specificity in which we want to tell the story of the patient. Since ICD-9 was created in the 1970s, and this ICD-10 was implemented in 2015, there was a lot of change and advances in medical science in those many decades. So we need to know why we went from ICD-9 to ICD-10, and we need to know that ICD-10-CM replaced ICD-9-CM volumes 1 and 2. Also, the code set is updated annually on October 1st. So it was implemented on October 1st, and it's updated on October 1st. So now let's talk about ICD-10-PCS. ICD-10-PCS was developed by CMS. And at this point in time, going into Coding 2, all students should know what CMS is. The Centers for Medicare and Medicaid So we know that this system was developed by a different team than ICD-10-CM. So we had the NCHS, and now we have CMS, the Center for Medicare and Medicaid Services. So the intent behind ICD-10-PCS is to provide a coding system that is more specific and consistent than any other system ever developed. ICD-10-PCS is a brand new system, and it's going to be more detailed and consistent than any other system ever developed, because we're telling that story of the patient and we want to be detailed. So the code length here is 7 characters. It's always going to be 7 characters for ICD-10-PCS. This is different from ICD-10-CM when we said ICD-10-CM code can range from 3 to 7 characters. An ICD-10-PCS code is always going to be 7 characters, no matter what. So our code format here is alphanumeric, just like CM, and we have some examples below. So when do we use ICD-10-PCS? ICD-10-PCS is used to code procedures in the inpatient hospital setting only. So I cannot emphasize this enough. The patient has to have a formal order for admission to the inpatient status in order for this code set to be utilized to code for procedures. This is the only time this code set is used. So ICD-10-PCS is commonly referred to as procedure codes or PCS codes. If you're going to refer to it as procedure codes, you definitely need to know what patient type or the level of patient care that you're dealing with. Procedure codes describe the services healthcare professionals provide. So when you're admitted for a knee replacement and the doctor admits you for 48 hours as an inpatient, then this is the system that you're going to use to code that knee replacement. So when we're telling the story of the patient, we know ICD-10-CM codes are the why, but ICD-10-PCS codes are the what. So this explains what happens to the patient while they sought healthcare. What services did the provider provide to the patient? So now we have a why and a what. So you can see that the story is starting to come together. So let's talk about the why, right? The patient has advanced arthritis of the knee, so they're coming to get their knee replaced. So it's that arthritis that explains why the patient's seeking treatment, and the knee replacement is what happened to the patient while they were seeking those services. So it was what was provided to that patient. Important notes to remember for ICD-10-PCS is that it was implemented October 1st, 2015 as well, and that it replaced ICD-9-CM Volume 3. Remember, this is a brand new system that was created. So this actually replaces that third volume of ICD-9-CM that we talked about on the last slide. And this code set is updated annually on October 1st as well. So easy thing to remember is that all ICD-10-CM and PCS, so all ICD-10s used in the United States, were implemented on October 1st, 2015, and they are updated annually on October 1st. Now let's talk a little bit about CPT. So we have the current procedural terminology code set. And remember, this one is the one that conflicts a little bit with ICD-10-PCS, so we need to make sure that we understand the differences and the nuances between the two and when they're used. So CPT was developed by the AMA, the American Medical Association. So now we know we have 3 code sets developed by 3 different organizations. Like we saw on that first slide, it's like, why do we have them? Because they were developed by a bunch of different organizations. And here we have 3 code sets developed by 3 different organizations. So the intent of CPT is to provide a coding system that identifies billable services provided to patients, including all outpatient services. So what this means is that we're identifying what happened, what procedures happened to patients in all outpatient services, but we're also identifying the physician fees, so the billable service that a physician can charge. And this happens in all settings, whether it's inpatient or outpatient, for physician billing. But when we're just doing medical coding, not physician billing, we only use CPT procedure codes in the outpatient world, which is everything except the inpatient hospital setting. So the code length here is 5 characters. However, modifiers may be used in addition to the 5-character code, and modifiers are unique and specific to CPT coding. So there are no modifiers in ICD-10, ICD-10-CM, or ICD-10-PCS. Modifiers are specific to CPT coding. And we have some examples below. So the first example, 99213, that's just a straight 5-digit character CPT code. And then we have 36415-50. In the real world, there is no dash, but this is how we, in the educational setting, show you that this is a modifier attached. So we have the 5 characters with the 2-digit modifier attached. So CPT is used to code procedures. So hospital outpatient settings and physician offices. So basically all outpatient services, like we've said a few times before. And then we also know that CPT is used to code for physician services, so physician fees or pro fee. Important notes is that this code set is updated annually on January 1st, right? So this differs from ICD-10. So telling the patient's story, as I told you, I like to think about medical coding being, we're saying why the patient's here, what services were provided to the patient, we're saying what happened, when, how, where, who, all that good stuff. So let's walk through this and talk this out. So the who, what, where, when, why, how, all of that we're going to answer. So we start with the who. Who is followed by why. Then we have the what, the how, and the where. Okay? So those are the questions that we need to follow and make sure that we're using data codes to explain this information when we are submitting bills to a third-party payer. So who is always going to be the patient? The why is, why did the patient come to seek treatment? That's always going to be a diagnosis code or ICD-10-CM code, regardless of the patient care setting. So we're always going to say why the patient's there on every claim, and it's always going to be ICD-10-CM. So an important thing to remember is that you cannot use a procedure code, whether it's ICD-10-PCS or CPT, without providing an diagnosis code. So every claim has to have why the patient came, and that's ICD-10-CM. Then we're going to talk about the what. What did the provider do to address the why? Right? You came in with an ingrown toenail. Your provider removed the toenail. So that procedure would be the toenail remover, and the why is the ingrown toenail. So this would be if it's in the outpatient setting, if the toenail is being removed just in the physician's office, this would be a CPT code. If this was done because the patient was admitted as an inpatient in the hospital, this would be an ICD-10 PCS code. So the what depends on the patient care setting. So that means depending on the patient care setting, depends on whether we're going to utilize ICD-10 PCS code set or CPT code set for coding procedures. And then if we want to talk about the how did the injury or poisoning happen? Then we're going to use ICD-10 CM as well. These codes are going to be known as external cause codes. And the where did it happen? Did it happen in your garage? Did it happen at work? These are also going to be ICD-10 CM codes. So you can see that we're really starting to tell a robust story. We're saying patient Smith had an ingrown toenail, had it removed in the physician's office, and the injury happened because a cow stepped on her toe 10 months ago, and it happened when she was at work on a farm. That's how detailed we can be when we're coding, and this is how detailed I want you to be going into coding too. This is how detailed you should always be when attempting to code. I don't expect everyone to be perfect, but this is what we should be practicing. When we're coding, especially when we're using case studies, we need to make sure that we know who this is about, why, what, how, and where. So it's always going to be important to know whether to establish the patient setting. So are we talking inpatient or outpatient? And that's one of the first things you need to do is when you're looking at a case study is to identify whether this is an inpatient or an outpatient, because that's going to tell you what code sets to use. Okay, so I hope this helped clarify when we use certain code sets, how we use certain code sets, and some important information that you need to know regarding these code sets, because those are commonly asked questions and details that you will need to know throughout your health information technology and health information management career. So if you have any questions, please feel free to leave a comment. I'm always here for the students, and I hope that you're starting to get back into the swing of coding, and at least you understand code sets, what code sets we're using in the program, when, where, how, why, and all that good stuff. So tell those stories, tell them detailed, and ask questions, and I'm always here to help. I hope you enjoyed this review. Thank you.